to Hippodrome Theatre from July 24th to 26th, 2025, showcasing the best in Nigerian arts, music, fashion, and investment opportunities. Whether you're looking to discover the future of real estate, explore Nigeria's culinary masterpieces, or get immersed in an electric Afrobeat performance, this is the event of the year. You can also join us for a film festival, cultural dance spectacles, and the recognition awards. Don't miss out on the business opportunities and cultural experiences waiting for you. Book your tickets now before they're gone on eventbrite.co.uk. Call or text +447 438 893 190 or 080 330 46768 or +447 459 071 747. Visit our website superiorradioandtelevision.com. Nigeria Week London 2025. Nigeria Week London 2025, celebrating the best of Nigeria, is partnered with Civil Society, scaling up nutrition in Nigeria.
Viewer out there, you're welcome to SRTV Studios here in Delta State. We are reaching you simultaneously from the studios in London, Abuja, and Lagos. And this is Inside Delta, where we focus on issues and how they affect the populace in Delta. And incidentally, on this edition, we are looking at an issue that is of concern to everybody, and that has to do with malaria scourge and how the insecticide-treated nets have come to the rescue. We want to look at the issue from all sides and find out to what extent is the net option working out, and to what extent that has been a rescue to the scourge of malaria. So we have experts right here in the studio, and it's heartwarming to actually welcome them. I have with me Dr. Ania Julia of the State Ministry of Health. You are welcome, Doc.
Thank you.
Yeah, thank you so very much. And we also have Joan Ocholi. Sorry, actually, it's John Ocholi. Yes. He's a project director for Society for Family Health. You are a medic.
In the field, not directly medical, but work in the medical field.
You work in the medical field. Yes. Yeah, I want to be very sure of that. So we'll start with Dr. Julie, if you permit me to call you that. Is it right for somebody who possibly is not of the health sector to describe the issue of malaria in Nigeria as a scourge? Is it right, medically speaking?
Yes, it is right. But malaria is a disease that is caused by the bite of an infected female Anopheles mosquito. And it is a deadly disease. Though it has cure, it has treatment, but when it is not handled on time, when the person does not present on time, it is deadly. It kills. And it affects everybody. It affects both the young, the old, male, female, children, adults. So it can be described as a scourge.
Yeah, we will also want to find out is having described it as a scourge, and you are of the Delta State Ministry of Health. There are some health policies that the government has been trying to implement. Is there any nexus between these policies and the global effort to stem that scourge? Is there?
Yes, there is a global effort and a national effort that has been used and is still ongoing, that we are using to bring down the effect of malaria on our citizens. The government and the partners supporting malaria have been able to put together these programs for the management and prevention of malaria. They have put in place the free maternal care, that any pregnant woman who goes to any health facility is given free net on registration, on booking. And then that woman, if depending on the time of presentation, that the pregnancy has reached quickening, what we call quickening is 4 months or 16 weeks.
Okay.
The woman is entitled to what we call SP. Sulfonamide pyrimethamine is a drug that is given at the point of registration, when the woman is 4 months gone, and it is taken there and then by the patient. We call it DOTS, directly observed therapy.
Okay.
So that we will be sure that the person has taken it. That is one of the things. And then for children under 5 years, they have free treatment for malaria, free management, and they get children at 9 months, when they have completed immunization, they get a free net. So every child that comes and has completed immunization gets a free net, and then they are also entitled to free treatment. We give them ACTs if they are actually sick after the test has shown positive, either RODT or the microscopy is positive. They are treated for free.
Okay.
There's this monthly sanitation program that is done all over the country and also in Delta State. We clean our environment, make sure that everywhere is properly taken care of. This is one of the things that the government have put in place to help curb the scourge of malaria.
All right. That's talking about taking care of our environment. Because like it is usually said that prevention is better than cure. Project director, can you put that in perspective? The cost of treating malaria, because I have my own way of sometimes the duty calls. I visit some of the health facilities and I see a preponderance of people surging to see doctors. I have a feeling our doctors are overworked, you know, and if you sample opinion, quite a number of them are there on the grounds of malaria. You understand? So, why they are there, they are not in their offices. So it's expensive for them to be there. Production is stalled, you know. That put side by side with an enlightenment that makes people prevent the things that cause malaria. Which part do you think we actually need to go?
Thank you very much. So again, like we keep saying, malaria is endemic in Nigeria. Endemic means that for every part of the country, people are susceptible to getting malaria because the mosquito that spread the parasite is very available with us here. And we can prevent it, which is the low-hanging fruits. It's always good to prevent. When we are active, as we're seated now, mosquitoes can't really bite us because we keep moving our bodies. Sometimes when you wear long clothing, even if it's in the evening, it reduces the contact the mosquitoes can have with you. Then sometimes when you are sleeping, you really want to find how you can protect yourself, and that's why we talk about using the net. But when people get the malaria disease or sickness, it costs a lot on the family because people need to take care of themselves. And when people take care of themselves, they are spending out of pocket. So the funds that are supposed to be used for other things are used instead to treat the malaria. And then when families have to spend money on treatments, it affects even nutrition and other things that the family can get. Apart from that, like you talk about man hour, when people are sick, they can't go to office. So it affects man hour, it affects productivity. Children can't go to school because they are sick, and assignments or note copy tend to pile up for them, and if later maybe the child is not able to cope, or the child is not performing well because the child is most time out of school. There are some children that get this episode so often, as long as they are so maybe prone to mosquito bites as frequent as all that. Then if you talk about the healthcare also, yes, like you say, from statistics, it shows that 6 out of every 10 patients in the hospital are there because of malaria. So if we don't have malaria, obviously it will free the doctors and the medical team to have opportunities to take good care of other illnesses or diseases that are available. And then if you also take statistics of mortality in the country, we're saying that for every 10 children that are reported, that 3 of them are mostly due to malaria. From pregnant women, 10 that have complications, 1 of them is related to malaria. And so these are things that we need to really see. And so it affects the country, it affects the economy, it affects the manpower at the delivery of healthcare provision, it affects the family for even trying to create wealth. So malaria is a very serious. So if we compare that to prevention, prevention is better, always better and cheaper than treatment. And that is why the government of Delta, with the federal government and other partners, announced that among the things we can use to prevent malaria, the net is being provided in Delta State to be distributed to people all over the state.
Thank you so very much. That's good to hear. Available statistics have it that Nigeria has the highest burden of malaria globally, accounting for nearly 27% of the global malaria burden. This is happening at a time when we have had all manner of campaigns, including rollback malaria. And this is not the first edition of the awareness creation, sensitization for the, insecticide-treated nets. Would you say, would you, in all sincerity, say we have been carrying out some of this program with the kind of attention it deserves? Or has it been a case of some short-termism, and at the end of the day, we find out that the more programs we are carrying out, the more malaria is out there dealing with people, even in the urban, including the rural areas? What's your take, really, as somebody who has been in the field on?
Yeah, so I will say that in summary, we are making positive progress, very positive progress, based on statistics available over the years. So I can take us down memory lane, like 2010, some 15 years ago, when one of the first baselines was done in the country to analyze or evaluate what it's like, the incidence or the burden of malaria. As at that time, we had the incidence of about 45%, which means that from every 10 people you count, you see the parasite in the blood of 5. That's what it meant. Now, all efforts went into how do we bring this down? And then we went into what we call scale up for impact, SUFI. And that scale up for impact was when the net campaign started in the country. The first campaign was in Kano in 2008. Okay. And then subsequently, there have been campaigns. In Delta, this will be the 4th campaign in Delta. There was one in 2011, 2019, 2022, and then this 2025. So the net is one of the aspects. The other aspect was that we moved from chloroquine to ACT, the combination therapy, artemisinin combination therapy. Yeah. Then we also moved from people just treating blindly. When you feel sick, you just take. We now went to say, test before you treat. And then we also went into empowering healthcare providers. So sometimes you go to the clinic or go to a pharmacy, they give you the drug. You see the health provider, don't just give you the drug. They'll call you and say, look, you need to take it at this hour. 8 hours later, you take it. They also tell you, hey, be careful when you're taking it because of vitamin C and the others. Those are the trainings that also healthcare workers have to ensure that people get it well. Now, when we did that, from 2010, by 2015, when we checked it, it had dropped from 45 to 27, which means that from 10 people you now check, you see it in 3 people. So effort was being done. As at last check in 2021-22, it is now about 21%, which means from every 10 people, only 2 people now have the parasite. So most times, and that's why we're telling people, when you feel sick, it's not malaria all the time. It might just be malaria. It could also be something else. So we're encouraging people that when you fall sick, please see a medical person so you can do a test. If it's malaria, they give you ACT. If it's not malaria, further investigation is done and you're treated correctly. So a lot of efforts have happened. We are making progress and we can push forward. In Africa recently, Egypt was certified malaria-free. Cape Verde certified malaria-free. Algeria certified malaria-free. Nigeria can be. It might not be today, it might not be tomorrow, but we want to do it in our own lifetime. That is why we say malaria ends with us. That is the theme for the Malaria 2025. It should end with us. Our children should hear about it, not experience it. Our grandchildren.
Okay, that's indeed on a good note. There are people out there who tell us that the campaign is media based, and after the people are sensitized, they go out there and they can hardly see the nets. You know, so what is the use of a campaign and sensitization? And at the end of the day, is it correct to say that after the media bleeds, the nets go back to the market and the people who actually need the net cannot access them? Doctor, is there a way you can come up and help us with that?
Yeah, thank you very much for that. The nets are available as we speak. They are moving them from the central store in Asaba to all the.
Oh, they've reached Delta.
They've reached Delta.
Okay.
They are now being moved from the central store in Delta in Asaba to all the LGAs.
But some samples didn't come for this program to demonstrate.
They will get, everybody will get, the people that need to get the nets, they will get from next month.
Okay, could you define the population that needs to get?
The population that needs to get the net,
yeah,
is every household.
Okay.
The strategy we are using this time is get the household mobilizers will first go and mobilize the houses. They give them net cards, now known as token. This token will be registered.
That's like a pass.
As a pass,
okay.
A pass.
Mm.
So after that, there will be a time that these household members will now go with the token to the DP, the distribution point, to redeem their nets. They will go there, give me your number. Okay, you are entitled to 3 nets, or you are entitled to 2 nets, depending on the number of people in that household. So the nets.
Is it right to say 2 persons to a net?
Yes.
Okay.
2 persons
to a net. All right. Okay. So our project director, there are some of the, I don't know whether to call them cultural nuances. There are some persons who believe that the insecticide treated nets, yes, they may prevent malaria because they won't allow mosquito to come in, but that they generate heat when you are sleeping inside them. Is there a way you could use this platform, which is a global and also locally relevant platform, to address that issue, especially if you have ever been confronted by that kind of situation of people who say they can't sleep comfortably inside a mosquito-treated net. So if you give 10 to such person in a household, they end up in the garage, or they end up in the store, and they are not being used. And at the end of the day, we are still going round and round. There are some nuances. There are some cultural resistance to this kind of sensitization. You understand? So can we address some of such so that?
Yes, we can.
Yeah.
But before we go there, it's also good just to, if you allow me to add to
please
the
do.
earlier question.
Please do.
So just to say that, like the program manager said, Dr. Julie, the nets are already in the States. The nets are moving to the LGAs. And between 8th of May and 15th of May, people will go around the houses, like she said, we'll call them household mobilizers. Okay. They'll be wearing reflective jackets, I think lemon green. They'll move in pairs. They'll come to the household, and then they'll ask questions about how many people currently live in the house. And we want people to be honest, to give them the right number, because it's based on how many nets the house will get. Then again, between 26th and 30th, the people will now use those tokens and go to distribution points where they will now get free net in exchange for that token when they present the token. And to make it easy, like you said, let it not be something on the TV. In Delta, we are going to be using about 1,582 distribution points across the state, just like you have polling units.
Okay.
So we try to make them as close to households as possible to reduce transportation. There might be places where we have riverine or difficult terrain. We are still discussing with the state and the local government chairmen who have been very magnanimous to come sit with us to see how we can plan for this to really happen. So that will happen. So now talking about the myths and misconception that people have about the net.
Yes.
I just want to say that the net is certified. It has been tested by NAFTA, by WHO to be safe for people to use. Sometimes people talk about the heat that comes when you sleep inside the net, and yes, there will be heat within an enclosure. But what we advise people is that when you sleep outside the net and mosquitoes will bite you, you use blanket or bed sheet to cover yourself. So you create heat by yourself that is close to you. All right. So we're saying that when you use the net, sleep light, wear a t-shirt, wear singlet, and sleep inside. Then you don't need the blanket to cover yourself again. The net becomes the blanket, but from a far place. Open the windows. Then again, sometimes people sleep outside in the compound when the weather is hot. We are saying that time that children sleep, especially in rural areas, get these 4 buckets, this paint rubber, the 4 liters, get 4 of them and get sticks. And put the stick and put the net, even in the mat. You can put this so children can sleep while they are lying outside so mosquitoes don't bite them. And then if we are able to do this and reduce the bite of the vector, the mosquito is the vector that transmits the parasite. Once we can cut that transmission, we are able to begin to reduce, because mosquito to transmit the parasite needs to pick it from an infected person to give somebody. So if you are not infected and the mosquito bites you, we're not too worried. And that's why we say even sometimes when there are mosquitoes and the infection is not much, then transmission will be very low.
Okay. Oh, that's interesting. Doc, please, could you enlighten us? What's the level of support this campaign is getting from NGOs and some private sector players, considering that the issue of mosquito is something that everybody should be concerned about? If in this studio tomorrow, we have some major programs and the producers and technical hands cannot come because they are down on malaria, then it will be a drawback on the target we are trying to achieve. Same for factories and all those places. So what level of support are you getting from NGOs? What level of support from other agencies, locally and internationally?
Great. The level of support it's very good, and to put it in percentage, it's about 70 to 80%, if not more. The person that is with me here is a partner supporting malaria. So he's one of the people that is supporting the malaria. His organization is SFH.
Okay.
They are actually the ones implementing it. While we have other partners that are still supporting, like the CROS, which is the principal recipient to this grant, this GC7 grant, and other partners too. MSH, Society for Family Health, Management Sciences for Health, ACOMI, and some others that I may not want to mention here because of time. So we are really getting support from them, and with their support, I know the campaign will be very successful. And I pray that everybody, Deltans, that need to come and enlist for this net should be enlisted, and then they get their nets. Because sleeping inside the net will make us get to the place where we say we'll end malaria. If we end malaria, we want to end malaria together and then eliminate malaria from Delta State.
I cannot wait to see a society without malaria, where malaria has been eliminated.
So there's a society without smallpox. Now we are getting without
society
polio.
Without
so
polio.
We are moving gradually, and we should believe we can do that too.
Okay.
All
So
we need is our commitment. We all need to be committed to this race, to this pursuit, so that we will end malaria together.
That is good to hear. Are there side effects to the use of, every drug doctor will tell me. There are drugs that you take, they say don't drive because it could make you drowsy and all that. So what are the side effects to this, to the use of...
So I will not say side effects.
Okay.
Rather, we'll say that when you don't use it as instructed, you might maybe just get a little pinch, just a little sensation on your body, but not something side effect. And that is why when we get the net, we advise that you should air the net for 24 hours.
Okay.
Under or in a shade, not in the sun.
On the sun,
yes. 24 hours, air it so I can get free air. Now that helps the packaging. When you package, sometimes when you open even some of the food items you see at home, you see some things inside it like a sachet, making sure that air doesn't come into it like that. So even the packaging of the net also has our own protection that keeps it safe in that pack. So when you air it, when you open it from the pack first, you want to air it for 24 hours. And once you do that, you use the net, you're not going to get any maybe burning sensation or anything on your body at all. But when you bring the net and you don't use that immediately, somebody say, the thing they hurt me, they pepper my body, is because they did not air it for 24 hours. Okay. And again, just to say about the campaign, some people keep saying, what do you want to do to discourage people from selling the net? So we are going to devalue the net. Devalue it in the sense that when we are giving people the net, we are removing it from the pack. So we are trying to reduce the market or the selling value of that net. Then there will be a lot of awareness being created across, just like we're doing now. We also use town announcers in the community that will do that to make sure that we're able to tell people what people need to know and all that. But it's a call by all of us to come in. But something we need to also say, because of the gain we are getting from reducing malaria in the country, there is what is also called the urban malaria control. So the urban malaria control and the urban malaria strategy says that we can stratify the country into smaller bits up to the ward level. And then we'll begin to look at the malaria prevalence in those places. So we now what we call the test positivity rate. We look at that. We also look at the built-up characteristics of the environment. And based on that, there are some places in Delta, even now, that we're thinking that this net will not be distributed in those wards. We have about 38 wards in Delta State that will not be getting net distribution.
Why?
So, because of what I've told you. So we have looked at the test positivity rate in those places, and we've seen that it is not net you need for all. People say, now only net now they do. No, there are other things to do. We can clean the environment. Remember I talked about the vector. The mosquito is the main thing. Yeah. So if we have places that are built up area that we can control water to reduce the vectors breeding, then we should pay attention more to that than the net. That's why we say deprioritize net, prioritize other things in those places. So in Delta, we are looking at, based on the strategies, based on the criteria, there will be like 38 of these wards that will not be getting net during this campaign. But all the other wards in the state will be getting net. And then where people go to get the net, there will be education and enlightenment on how they should use the net so that they don't get any burning sensation from it. Thank you.
Project Director, you explained these things very eloquently, especially as it has to do with the environment. Yeah. Because if we keep giving out the nets and we keep on carrying out the monthly environmental exercise the way we are doing it now, where we bring out things from the gutter, they are not evacuated. A few days after, they are back to that same gutter, and the gutters are not, the drainages are not desilted. Yeah. And at the end of the day, we are still having places where the mosquito can breed. Yeah. And at the end of the day, you find out that you are struggling with more of an environmental issue. Yeah. You may be distributing the net, but you are not getting. So I know
where you're going. So let me tell you something.
Please tell me. I'm eager to hear.
So now, that is why the minister, the current Minister of Health, has said that we should do a rethink malaria. Sometime around August last year, he called a meeting of all partners and all stakeholders across and partners from the international and said, let's rethink malaria in Nigeria. And then he now said, let's do the sector-wide approach. So when you're saying sector-wide approach and you want to manage malaria, you're not only looking at the Ministry of Health, . talking about. The Ministry of Education is involved. Women and youth, they're all involved. We want to, even Ministry of Works, because you're talking about drainages. So the minister is saying we all need to sit down and let us discuss together. Now, in managing the waste for this campaign that is going to happen now, there's what is called the EOLIN, end of life of nets, that we are also bringing in to say that all the nets we have given in the past, don't litter them in the community. As you're coming to collect a new net, bring your old net and exchange, and just bring your old net and exchange, because it's a voluntary thing.
Yeah.
Once you have the token, it's the token that entices you to a net. But we are encouraging people that they should bring the old net, so I don't litter the environment with them. So we are so much concerned about the cleaning of the environment. But I must say something, and that is the zero malaria we are talking about. Zero malaria starts with me, starts with us, is a call for everybody from wherever you stand to take the right action for us to reduce malaria. So if the government says there's monthly environmental sanitation, do people do sanitation? Let's ask ourselves. You as a Nigerian that mosquitoes are around your area, when they say do the sanitation, do we do it? We want people to stand up, think about their children, think about themselves, and think about what can happen, and do your bit. Let us do our bit first and then push the government and say, we have removed the gutters, so see them here, government should come and pack them. But again, we are trusting that with what we are pulling together, the government will also come and we can clean the gutters, clean the community, which is part of what we want to do for environmental management.
That's good news indeed. Dr. Julian, are you bothered one bit as a medic that there are a number of our people who, once they have a symptom, they go out there, buy malaria drug, they take, without trying to test to find out what am I really treating? Are you also not bothered about the level of resistance in some cases? You know, people take this drug, take it again, and it's become resistant, and it's result into a number of other things. As you are talking about the net, how do you also educate our people with relations to how they can actually, if they have been infected, how they can get free from the issue of malaria?
Thank you very much. This is a very important question. Relevant. My people, the malaria is something that is terrible. And when we know, we feel weak, we have fever, we don't need to run to the chemist to take drugs. Please go to any health facility, either a primary health care center or a hospital, where they will carry out tests to know whether it is malaria you are suffering from or something, another disease. Because not all fever, not all weakness is malaria. Not all fever is malaria. You could get upper respiratory tract infection and you are running temperature. Please let my people come out when they are sick for testing. The malaria testing is free. RODT testing is free. Microscopy is the one that is done in the hospital laboratories. That one is not free. The malaria RODT testing is free. Come out and run a test where they will find out if it is malaria. Then it will be treated with ACT. ACT is a combination therapy made up of 2 drugs that will fight the malaria to a standstill. If it is not malaria, other tests will be run for you, and then the proper and appropriate treatment will be given to you. If you go to take drugs on your own, drugs that are not prescribed, you will run, after a while, you will now find yourself not responding to malaria treatment. That is the resistance we talk about. We don't want us to be resistant of any drug. These drugs are chemicals. They are poisons. If we don't use them well, we don't use them as prescribed, we run into problems. We don't want us to run into problems. please do the right thing and get yourself treated appropriately. Thank you.
Thank you, Doctor. I'm not going to let you go in a hurry. You know, I so love doctors that about two of my children are part of your family, as it were. But truth be told, the nature of your job, I don't usually have time to discuss with them. Imagine calling your son and they're in an emergency section and you can't even discuss. So when I see people like you, I won't let them go at all. I want you to talk to us. This part of Asaba, you come out in the morning. They used to be in the morning. Now it's every time in the day, you know, even up till night. They call them mobile hospitals. Women that are carrying all manner of herbs. You know, if you want it diluted with hot, you want it diluted with water, you want it, they call it mobile, and they cure virtually everything. You know, they can set your waist, they can make you taller, they can make you, there's nothing they cannot cure, you know. But I wish I were actually a scientist, because somebody has said that the more is getting acceptable, the more we are having liver failures and some vital organ failures. But I have not been able to go to the lab, and I do not have what it takes to conduct a study, a research, to know, establish empirically what is the relationship between these two scenarios. But now that we have you in the studio today, what do you say to those who out there, their day is not yet complete until they see any of those mobile hospitals passing, and they wave them and they mix all those and they take, and the day can now start? Because I mean, and that can cure and wash away everything. Medically speaking, what's your take?
Medically speaking, it is not right to take such drugs. Such concoctions are not ideal, because even when they can cure, when we feel that they can give relief, at a momentary relief, we don't know, there's no dosage. We don't even know the components of those things that they are putting in their mouths. The components we don't know, the dosage we don't know, and then they end up destroying our organs, the liver, the kidneys. You say these days you will hear the kidney transplant, this person needs kidney, because of what we take in. These drugs are actually poisons, and when we don't control the intake of poisons, we don't know the direction it will take. It will go to the liver and destroy the liver, and when you destroy your liver, when the liver is diseased, there's no remedy. Once you do a liver surgery, it doesn't take time, the person passes. The liver, the kidneys too are also affected. When the kidneys are affected, you know, now people will be looking for kidneys to replace with, and that is not, it's not funny. It's not good for us to take medications without prescription and without knowing what we are taking. These orthodox drugs, they are prescribed, and we have prescriptions already. They have been tested, they have gone through trials. So when you take them with the prescription, the right prescription, you will get healed. Taking even the orthodox drugs without prescriptions, you are under, if you undertake it, it will not give you the appropriate effect. If you overtake it, there will be repercussion too. That is when you hear side effects. But when it is taken with the right prescription, you get healed, you get cured, and you'll be fine. Please, my people, do not do what is wrong. Practice the right things. Go to the hospital, see your doctors, let the doctor prescribe for you, and you will follow the regimen that has been given to you. Thank you.
Thank you so very much. Project Director, can you lend your voice to that?
Yeah, so I want to bring it in the layman's way of thinking. I just want to talk about the hot water. Yes, so you look at the hot water. Now, if you go to a village setting, or if you go to somebody who does not have anything about academics for hot water, The person can put water on the fire, the water boils. That water can pour and peel your skin and burn you terribly. But that same water, if you know that there's something called temperature, that at 4 degrees, 20 degrees, 30 degrees, the water is friendly or not, you can even use the water to bath. It will make you clean. You can use the water for tea. Or you take 100 degrees water, pour into your body without measure, it will burn your throat. It is the same thing with medication. We're not saying that those medicines don't work. The moringa and all the things we are saying, people are saying use them. But when they come in orthodox setting, they come measured in those right degrees that will take, and it will not hurt you, but it will help you. So let us try to ensure that we take them, even if they say that this is it. But the main thing is this: go to the clinic and do a test, know what is wrong with you. And the agbo you take might just be a Panadol. Or they might even say, just go and sleep and you'll be okay. So like doctor is saying, when you take them without control, it can damage your system. Thank you.
It has indeed been an exciting edition of Inside Delta and from SRTV studio here in Delta State. So we want to go on break now. And when we return, we'll be able to round up this program. It's a very important topic that we are actually dealing with, the issue of malaria scourge and how the insecticide treated nets have come to the rescue. So we see you at the other side of the program.
Looking for a home away from home in Abuja? Look no further than SRTV Shortlet Apartments. Our fully furnished apartments offers everything you need for a comfortable and relaxing stay. Unwind in spacious rooms with exquisite ambience. Cook delicious meals in our well-equipped kitchen and relax in our comfortable sitting rooms watching your favorite shows. And guess what? 247 Wi-Fi available. But that's not all. SRTV goes extra mile by providing a car to take you around town during your stay. No need to worry about navigating public transportation or hailing taxis. Explore Abuja at your own pace. Book your SRTV Shortlet apartment today and experience the perfect blend of comfort and convenience. You can reach us by calling this number 070-6237-9915 or 080-7082-7331.
Yeah, thank you so very much. You are once again welcome to Inside Delta from SRTV's studios. Dr. Julia said several people who are following us online have been calling her with respect to, you can make your contribution. It's a sensitization program. Please, you are free to make your contribution, and we'll collate all those towards, at the end of the day, being able to know how effective the sensitization is. But thank God that you're hooked on there and you are following with respect to the issue that is being discussed today. Project director, yes. You did give us an assurance that you were going to demarket the net.
Devalue it.
Or you were going to devalue the net.
Yes, please.
So that their market value will be reduced.
Yes, please.
That is when you are giving it to the in the household.
Yes.
But the fear has been that from the store where they are moved from here now to Patani, that some persons in the store will from there move them to a seller in the market. You understand? What have you put in place to ensure that what is targeted for the end users doesn't end up in the marketplace?
Okay, so what we did is from the onset of the plan for the campaign for Delta, we did what we call micro planning. So the micro planning gave us opportunity to go to each of the local government to get the quantity, the population of the people, and then the quantity of nets that will be required up to the ward level. And like I said, we divided even the ward to settlements. And for each of the settlement, maybe one or two, depending on the size, or even 3 settlements pulled together, we give them a distribution point where they are going to get the net. Now, the quantity of the net coming into the state, just to say that Delta, we are planning to distribute 3.1 million nets in the state. Now, this is broken down by local government. That's
quite significant.
Yeah, by local government, by wards, and even into the DPs, like we said. So as the nets are moving from Asaba, the quantity going to every LGA is marked. We are also using trackers to track the truck, track the quantity of net as it's leaving here We count it when it gets there. Somebody's counting it. When they are in the store, we also use the stock sheets to ensure that we have the quantities and all that.
Okay.
When we begin to move them from the LGA store to the distribution point, we also ensure that we also record them. That here in Asaba, we can look at our dashboard and see what is happening. Just to say that there will be technology used in this campaign so strongly, like last time and even more. So from the movement of net, we are seeing what is going. From the bringing of the net every day by day, because there will be 5 days of distribution. And we're looking at each of the distribution points will do like 500 nets every day. So sometimes they might do a little more or a little less, but we're looking at 500 nets every day. So we take those records every day and look at even the household mobilization that will be happening between 8 and 15. We also want to see on the dashboard how many people and how many places they are going to monitor them. So there's a lot of monitoring happening at the store level and even going to the devaluing of the net, like mentioned.
That would be good to hear. At this point, let's back up this discussion with some videos on the issue we are discussing. That's part of your movement?
Yes.
Okay.
World Malaria Day.
World Malaria Day.
Celebration.
Oh, okay, okay. So thus far, how has this campaign penetrated? At what levels have you penetrated?
We have penetrated the whole state, starting from Asaba. People have been sent to the LGAs to carry out trainings.
Okay.
As we speak, trainings are going on in all 25 LGAs.
Okay.
From tomorrow, the household mobilizers will be trained for the next 2 days, and then thereafter they will go and mobilize from the 8th to 15th of next month.
Yeah. Doctor, I want to thank you so very much for the great work that people like you are doing. I stopped having doctors as friends of late because each time the level gets to an intimate level, the next thing I ask of them, they say they have jabad. They are no longer in the country. They are practicing elsewhere now. So I would have wished to say, oh, I have your contact, but I know, am I hoping that when next I ask of you, you wouldn't have left the country for a greener pasture?
For now, no.
Are you here to stay?
I'm here to stay.
Until we achieve a zero malaria?
Yes.
Oh,
Yes.
You can see you have a great partner in
Yes.
Dr. Julia.
Yes.
She's here to stay.
Yeah.
It doesn't matter what is being offered out there. She's in here to stay. So we will all stay in here together until we are able to successfully achieve a zero malaria society. Thank you so very much. I can also assure you on behalf of the management of SRTV that we are very favorably disposed towards partnering with you. The studio is being coordinated from London, but it's such a Delta-centric studio that anything that will make Delta to be better than what it is what we are in for. So I want to thank you very much for coming, my brother John Ocholo. Thank you so very much.
Thank you very much.
And Dr. Julia, I look forward to seeing you again. Now that I'm sure that you are not going to be part of the brain drain, where people are interviewed here on a weekend, they enter the flight, and on a Monday, they are practicing in another country. We ask of them, we can't find them. Thank you so very much for coming.
Thank you for having us here.
Thank you so very much. Thank you so very much,
Thank
Project Director. Thank you very much.
Thank you.
Yeah. And this
Nigeria Week London 2025. It's time to celebrate the pulse of Africa's most exciting nation. Nigeria Week London 2025 is coming to Hippodrome Theatre from July 24th to 26, 2025, showcasing the best in Nigerian arts, music, fashion, and investment opportunities. Whether you're looking to discover the future of real estate, explore Nigeria's culinary masterpieces, or get immersed in an electric Afrobeat performance, this is the event of the year. You can also join us for a film festival, cultural dance spectacles, and the recognition awards. Don't miss out on the business opportunities and cultural experiences waiting for you. Book your tickets now before they're gone on eventbrite.co.uk. Call or text +447 438 893 190 or 080 330 46768 or +447